Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Cara Hope Rockwell.
And we want to thank all of our listeners for tuning in. If you haven't already, please be sure to like and subscribe and leave us a review.
And if there's any topics you're interested in hearing about or any particular guests you'd like for us to have on, you can let us know at sgmc.org/podcast.
All right, so today we are here with Leigh Hendley, who's a nurse practitioner at our SGMC Health Family Medicine location in Berrien County. So, Leigh, what brings you in today?
Well, first of all, thank you so much for inviting me to be with you today. And pretty much I'm here to talk about primary care, what we can offer in Nashville, some of the challenges we see, some of the conditions we see, and maybe a little bit about myself as to how I came about being in Nashville.
Perfect. Well, let's start with that. Tell me about your background and your education and kind of what made you pursue a career in healthcare.
Okay. Well, I am originally from this area. I grew up in Cook County, so I'm very familiar with living in a rural area. Mm-hmm. I don't have any great inspiring story as to what made me want to be a nurse. I basically knew I wanted to stay in this area. I did not want to have to go off to school. I was young and in love, ready to get married. So I looked at what VSU had to offer, and I just chose nursing. And that's how I ended up being in nursing. Now, I did work several years in a few different areas. At some point, I needed a break. I went back, got a degree in education, and taught high school for about 10 years.
Wow.
Taught healthcare and a few years of biology. And then somewhere during that time, I said, well, it's time to go back to nursing, but I think I would like to go on and get my nurse practitioner. And I was probably 40, early 40s when I went back, so I worried about that a little bit and how long I had been out of nursing, and would it have been too long? Would I have forgotten too much stuff? Was it going to be harder on me? Right. But, it's been great. I love what I do, and I love being in Nashville.
That's awesome. That's interesting, the teaching element. Which school did you teach at?
I was at Lanier County High School.
Okay, very good. So I'm very familiar with rural communities, too. I'm from Alapaha, Georgia, Berrien County. So we were rivals with Cook County in football, but y'all always won. So let's talk about primary care in a rural setting. So who do you typically see? What kind of patients do you see on a daily basis?
Our typical patients include a lot of high blood pressure, diabetes, asthma, COPD. There are just a lot of chronic conditions that we see in this area. So we just get a wide range of those things. And a lot of just heart conditions as well. In addition to the high blood pressure, we live in the South. We like fried foods. We like our carbs. So unfortunately, a lot of high cholesterol, some coronary artery disease. So we have a broad patient base with a variety of conditions, and then all age groups. And of course, we get our urgent care, our seasonal allergies, flu, COVID, all of those things on top of it.
Okay.
So just a wide variety.
Yeah, kind of a catch-all for anything.
Right.
What about those that don't have a primary care provider or had never, they went to the pediatrician as a child, now they found themselves 25, 30, have not had any real health care since then, maybe some urgent care visits. What would you say is the importance of establishing a relationship with a provider?
It's very important to establish a relationship with a provider because you do start seeing different conditions showing up. And I feel like, I don't have any statistics to put out there, but I feel like we see things sooner than we used to. You have kids in elementary school, middle school, high school that have high blood pressure. They're already diabetic. Obesity is a huge problem where we live, and probably across the United States, not just where we live. So it's important to just get in with the primary care, get those basic screening labs, know where you stand, know what your numbers are as far as your blood pressure and your A1C to screen for that diabetes. It's just good to go ahead and get established with them now. Plus, another thing we see is we see guidelines changing, where a blood pressure of 130 over 80 something or 90 didn't used to be considered, it was pre-hypertension. Now they've lowered those things. There's probably a lot of people walking around with high blood pressure, high blood sugars, and they don't know it because those are those things that you don't necessarily feel anyway. You feel good.
Right. What would you say drew you to family medicine specifically, and what do you love most about that?
One of my nursing jobs was as a nurse in a primary care office. So that's what I was most familiar with. And I just feel like, I guess it's a twofold reason. One, I want to be in primary care because that gives me the most broad experience. And then two, I feel like primary care is where I personally can do the most good. Especially because I've always known that I wanted to stay in a rural area. I can't explain why other than that's what I'm familiar with. That's how I grew up. But my heart has always been in rural health care. And I feel like primary care is where I could do the most good for the most number of people in that area.
We always say in our organization at SGMC Health that, while we have a large hospital here in Valdosta, so many of our patients are coming from those surrounding communities, and we truly are serving rural patients, rural communities, and that rural communities shouldn't have to suffer just because they're rural. They should still have access to the same level of health care and to enhance their quality of life.
Exactly.
What are some of those challenges that you see practicing in a rural setting that maybe people don't know about if they're not experienced it themselves?
A lot of challenges are that you just have a lack of specialties. Thankfully, we have, specialties that once in a while, once a month, come to Nashville. We have cardiology. That's great. Our hospital can do a lot of different tests, but just a lack of specialists. Even small towns don't have pediatricians.
Right.
I mean, I don't know how many are in Valdosta, but
we don't even have enough in Valdosta,
right,
really. It's a national trend,
full.
a shortage of physicians, but then especially when you go to rural communities, it's like you see that highlighted even, it's a greater need.
Right.
It is. So we definitely need more specialties. And then, you think about a pediatric patient that needs a specialist. They have to drive to Macon, Jacksonville, Atlanta, somewhere like that.
I think one of the most exciting things that we have as an organization going on is our partnership with Mercer University School of Medicine, because their sole mission is serving rural healthcare in Georgia. And so most of I think all of their medical students are Georgia natives, and then they get incentives and things for going out and serving in rural areas. So I'm excited to see how that partnership continues to grow, because I imagine that a big focus will be on our communities that are surrounding Lowndes.
Right. I hope that will be a great partnership, and because those students are Georgia natives, they will want to come and establish practices here.
Yeah.
So that we can get more providers and more specialties.
Absolutely. Absolutely. That's certainly a goal. What is the most common thing you see is it more urgent care, or do you have a pretty good primary care population?
It's more primary.
Okay.
A lot of follow-ups for their chronic conditions.
Gotcha.
We do still get a good bit of urgent care. I would say right now it's allergies, sinus infections.
That time of year.
It's just
Seasonal
that time of
illnesses.
year.
You cannot escape the seasonal allergies around here.
Right.
Okay.
So it's a little mixture of both, but most of it is primary.
Okay. And what do you tell people about why they should? I mean, how do you encourage? I'm sure you see people out and about, and you're like, yeah, work at the.
You should come see me.
Yes. Yeah. Why are people so hesitant to come to the doctor and get that checkup?
I don't know. I mean, honestly, even myself, how good are we even to go yearly to get our labs and our checkups and our screenings?
Yeah.
I mean, I wasn't beating down the door at 45 to have a colonoscopy.
Right.
There are so, but it is important.
Human nature. Yeah. It's that human,
It does help a little, even though I'm not from the Nashville community. My husband is, so we've lived in Berrien County going on 30 years. So I do know a lot of people. In some ways, that helps. You know,
a
the
little
person
encouragement,
that
like feeling a little more comfortable with who you're going to see.
the person that's not already established with a primary, they might be more comfortable coming to see me because they know me. So.
Absolutely.
And along those same lines, like how do you build trust with those patients and develop that relationship over time? Because that is unique sometimes to a primary care setting where you're seeing somebody year after year after year and getting to know them pretty well.
That's true. And I will say I've gotten a lot of comments on, I guess, the longevity of providers in rural areas. They may come for a little while and then they're gone.
Yeah.
And I have received a lot of comments asking, how long will you be here? How long are you going to be here? And I tell them, well, you know, I live here, so I'm going to be here as long as they'll let me be here. You know, I want to be here.
Yeah.
And just honesty, honesty with your patients. And having the time to be able to sit and talk with a patient and find common connections, because you know it's a rural area. They want to know who you are, who you're married to, who your family is, and so you make those connections with those patients, and just over time you develop that trust, that relationship with them.
Absolutely. And you're right about the longevity aspect. Just if you think about Berrien County and even Lanier County, you have Dr. Nash, who's been there forever, and Dr. Harrison in Lanier County, who's been there forever. And they're like staples in the community. So we need some more staples too, because, you know, at some point they will retire. So it's coming at that next generation of who's going to be that community
Exactly.
physician.
I mean, Berrien's fortunate to have those physicians who have ties to the community, and they have been there a long time, and they're great physicians. But yes, one day they're going to want to retire, and we need people who want to be in a rural area and enjoy being in a rural area.
And it does take, I think what you said, being from a rural community, you tend to want to come back and serve in that community. And I think that is the key to that longevity, is having somebody that's from the area and familiar and understanding and loves that lifestyle, you know?
Right.
It's not bad, but it's taking someone from a completely different lifestyle and trying to implant them into a smaller community can be challenging, right?
Yes, it definitely can, because I don't think they know. They may have an idea of rural health care and living in a rural area, but then when they actually go live and work in that rural area, they may decide, this is not really what I thought it was going to be, or this is just not what I'm used to. It's too different. So,
Well, we're glad to have you.
and I am so glad to be in Nashville. I am, and glad to be here on the podcast today.
Okay.
How do you approach health education with patients who maybe don't have the same access to resources as someone does in a bigger city?
I think with primary care, a big part of their treatment is education and handouts, depending on their insurance. If it's diabetic education, getting home health in, getting them into, and I realize sometimes transportation is an issue, getting them down here for diabetes education. But they do offer it in Berrien, they offer it in Lanier. I mean, we still have to get them there.
Sure.
But just a lot of different ways. Just giving them resources, websites, handouts, things like that.
I know we do a community health needs assessment every 3 years at each of our facilities, and something that we see on there consistently for Berrien and Lanier, and heck, even main campus, is the transportation issue, the lack of specialties, and so we're always cognizant and looking at how we can better serve and what we're going to be able to do. The good thing about the new Berrien at Berrien, we have the new ER, so that's like phenomenal to have state-of-the-art facilities there. And then it was built for a 2-story. I mean, it does have a second-story floor on the building, so there's still some opportunity of what we could be able to bring to best serve the area. Of course, you want to make sure doing your research and bringing what people need and what they want access to, but I know they're constantly looking.
Yes, and it's a lot of
kind of stuff.
possibilities.
Yeah.
And it would be exciting to get some more things that come to Nashville, especially specialties. But then you look at how overwhelmed the specialists that we have are.
It's hard.
And it's like, well, they're already overwhelmed here.
Yeah.
And then you want to try to get them in another community a day a month or 2 days a month or whatever.
It's challenging, and it's no rest for the weary. Everyone wants to serve and be there for the people, but because of the need, it's hard to make sure you're serving the most people. But again,
so
we still are passionate about rural healthcare. So
Yes.
What do you think is the biggest misconception about rural healthcare?
I would almost want to think that some people might think that rural health care is not as good. If I'm saying that right.
Yeah.
But it is. I mean, and I will have some people that say they like coming to a small clinic. They feel like someone's taking up more time with them.
Right.
Sure.
They feel like they're getting more personalized care, and that makes me feel good when I have someone say that. Because it's not sub-care,
Right.
subpar
No.
next to
No.
anything else. We're just in a rural area.
You would do the exact same thing in a larger area. You just are
Exactly.
physically located somewhere
Exactly.
else.
We're just physically in a smaller area with less resources. So.
But obviously,
But all the connections.
I was going to say, obviously,
Yeah.
it's great that you're connected with
Yeah.
somewhere that does have more resources.
Yes, that is so nice.
And access to specialty, because the one good thing about if you are a patient of yours and you get into the SGMC Health network, then we have the MyChart, the Epic platform that all of the other specialists are on, most of them. And so it's a little bit more integrated level of care, a little bit more convenience for patients when they're having to go somewhere.
And it's so nice when I refer patients out to be able to see
What the
what their visit was, what their labs, their tests, their imaging. So I do love when they stay within the SGMC network.
Yeah.
As far as that, because it's so much. I'm sure it's easier on the specialist.
Right.
It's definitely easier on primary care to that continuity of care and know what's going on.
And easier on the patient, because that's
It
less
is.
like, you're not having to navigate different records and different information. You kind of have it all put together in one spot. So that's definitely been a big advancement that we've seen over the last couple of
Yes.
years as we've added a lot of different clinics.
And that's very nice.
Has that been, what's the biggest change you've seen over, so you were a nurse and then you went to Utah and then you went back to become a nurse practitioner. What was the biggest change you saw over those years?
It's funny how much of primary care, even just working as a nurse in a primary care office, I mean, I wasn't seeing the patients, I wasn't diagnosing, treating them, but it's funny how much I remembered just from primary care that was still true today.
Still held true, yeah.
Of course, things change, guidelines change, treatments, medicines, all of that, but a lot of it has stayed the same.
Yeah. Do you feel like you're kind of, these patients, you're like just their coach, you're helping them, coaching them to be the best version of themselves in some way?
That's a good way to think about it. I would like for them to see me that way because I want them to be advocates for their own health. I don't want to just be in the chair saying, this is what you have, this is what you need to take.
Yeah.
I want people to be educated about their disorder. What can I do outside of clinic visits as far as diet, exercise, mental health, things that they can do to help their condition. And education is key with that. Just being educated.
And one good thing about family medicine, too, is there is that women's health aspect of it as well. So, a lot of times rural areas don't have OBGYNs either. So women can go see a family medicine provider and get those annual screenings that they need through that as well.
That's right. And we do have a lot that choose to they don't want to have to go to Valdosta to get those. So they do choose to stay and get those with primary care.
The primary care, the OB, the pediatricians that you brought back, and that's definitely a focus for our organization as we're moving forward, because we're seeing that, and with us opening the new Women's and Infants Tower coming next year, certainly stronger partnerships with the OBGYNs, pediatricians, neonatologists in the community, and then seeing how we can grow that and provide some more access to rural communities, because that's where a big need is.
It is, very much so. Especially when you think of, I can't think of one small town really that has a pediatrician.
No, I know. And y'all probably just serve that that function right now, as best you can.
Right. But it's definitely different. I mean, I'm more comfortable with adults. I do see children, but I'm not a pediatrician. So, yeah.
Yeah, we gotta train some more up.
That's right.
Be here.
What advice would you give to somebody who's considering becoming a nurse practitioner?
If it's what they want to do, I think they should definitely pursue it. There are a lot of schools to go through. They have really made it, I'm not going to say easy, but you do have where you can do hybrid. You can do online until you get to your practicums or clinicals. But because all of them, you do have to complete the practicums in different areas, start looking for those early. I did not realize how hard it would be to find preceptors willing to take students, and those that are willing to take students, they fill up quickly.
Yeah.
So start looking early for people who will let you come back and be a student in their clinic.
Yeah, and I think what you were referencing was being more accessible probably for those training programs, because I'm sure they've had to evolve as the need has gotten there. So they're trying to make it entice more people to pursue those degrees, and so making them more accessible, but not necessarily more easy. I'm sure it's very difficult.
More accessible. Yes, that's the much better word than easy, because I'm definitely not going to say it was easy.
Nothing in the medical.
But easy as far as working with your schedule and still being
with
able
a working
to work.
lifestyle, like recognizing you're probably working while
Exactly.
attaining, advancing your education. I think it's what we're seeing kind of throughout the entire realm of all healthcare professionals, whether it be a phlebotomist or a imaging, technician or what have you. There's such a demand for all these different support areas in healthcare too, that we're really having to get creative with how we're training those to make sure that we continue to fill those positions, because all that support stuff supports our docs and our providers.
That's one thing about healthcare. You will always have a job.
Yeah.
That is true. And that's what whenever I taught healthcare, that's what I told them. I said, you don't have to be a hospital nurse. You don't have to do this or do that. I said, but you will always have a job if you go into healthcare.
There's always a physician available, and there's so many different avenues.
Nursing especially is so flexible. There are so many different routes you can take as a nurse.
Yeah. And we have one episode that we did with Sharice Giddens, who's our chief nursing officer, but who's also from ADEL. But she's been here like 40 plus years or something, and that's wild to me. But just all the opportunities for nursing in a health system is just impressive.
Right.
Is there any final piece of advice you'd like to leave with us for patients out there who might be listening?
Definitely get established with a primary care. Just so you are established with someone if you need them.
Right. Let me ask one question too before. What is the advantage? Is the advantage for the patient if they're already established and then they come down with something? Does that then allow them to either call in or kind of help with that, with the more sick or I guess urgent situations that aren't necessarily the primary care?
It does. If you're already established and say you've been in within the past month or two and you call with a question, concern, needing something, I'm already familiar with you. I'm already familiar with what medicines you're on, what conditions you have. It might be a possibility to treat over the phone without you having to come in. But if you are someone we don't know anything about and we don't have any basic history, medicines, anything like that, it's just going to require that you come into the office for a visit.
Right.
And then that, hopefully, we're not so busy that we don't usually have an opening or a way to work someone in, but it's just a little easier if you're already
Yeah,
established.
for sure. So it adds a convenience factor for the patient.
Exactly.
Okay. Now go back to what your question was.
Yeah,
'cause
no,
I stole-
it's okay. We were just talking about a piece of advice you would give.
Yeah.
So establish a relationship with a provider.
Exactly. And know where you stand.
Know your numbers.
Exactly. Know your numbers, know your blood pressure, know your A1C. Someone may come in for their initial primary care visit, get their screening labs, they're doing great, and it's like, all right, just see me in a year unless you need me before.
Keep doing what
because
you're doing.
You're doing good. Keep doing what you're doing, but at least that way you know.
Yeah,
Yeah.
absolutely. Gives
Right.
you some peace of mind.
Exactly. You're exactly right.
All right. Well, I think that wraps us up for today. We thank you for joining us.
Well, thank you for asking.
And we will link information to your practice there so that if anybody would like to establish an appointment as a new patient, you can go ahead and just check that off the list and be done with that.
All right. Thank you. See you next time.